AI diagnosing diseases, like way earlier than human doctors, sometimes even months.
Yeah.
It's kind of mind-blowing, right?
Yeah. It's pretty amazing.
We're talking Google DeepMind,
Yeah.
like getting 94% accuracy with retinal diseases just from like eye scans.
Right.
And then there's IBM Watson, picking up cancer markers.
Hmm.
So early intervention, that seems to be where it's at.
Mm-hmm.
And it's fascinating to see AI right there on the front lines.
Yeah, definitely. And it's not magic.
Right.
But it almost seems like these systems are crunching like massive amounts of data, patient histories, scans, test results, and they're doing it so fast.
Right.
It's all about spotting those patterns, the connections that even a really experienced doctor might miss.
It's like having a medical student who's already read like every textbook, every journal article.
Exactly, yeah.
But even better, right?
Yeah.
They never need a coffee.
Right.
Never get tired. The thing that really gets me is AI and image analysis.
Mm-hmm.
X-rays, MRIs, CT scans. It's like AI has X-ray vision, like literally, spotting tumors, fractures, even signs of neurological disorders.
Well, think about it. A radiologist has to process so much visual information. AI can analyze those images, compare them to millions of others like that.
Wow.
So it's not really surprising that, AI is hitting 95% accuracy in lung cancer diagnosis. Some cases it's even better than human radiologists.
Yeah, that's a total game changer. But it's not just about reacting to what we can already see, right?
Yeah.
AI is getting into preventive care, too. Like predicting diseases before you even have symptoms.
Right. So imagine AI looking at, your family history, genetics, lifestyle, all of it, and then it says, hey, there's a chance you might develop heart disease or diabetes down the line. That's some powerful knowledge right there, because then you can make changes, or start medical interventions and maybe totally change your health trajectory.
It really makes you rethink how we approach healthcare. It's always been reactive. You get sick, you go to the doctor.
Mm-hmm.
But with AI, maybe it becomes more proactive, like preventing illness altogether.
Yeah, it's like a partnership, You have human doctors, they bring experience, expertise, and they can really connect with patients, right? On a human level.
Right.
And AI, it comes in as this amazing tool, like augmenting their skills with speed, with precision, with the ability to see patterns in huge amounts of data.
It's like AI gives doctors a superpower.
Yeah, exactly.
Helping them make like way more informed decisions, provide even better care.
Yeah.
Which brings us to that big question.
Yeah.
Can AI actually replace doctors entirely?
Mm-hmm.
On one hand, the speed and accuracy of AI with diagnostics, it's undeniable. But on the other, there's that human element of care that just seems irreplaceable, What are your thoughts?
Well, it's a debate.
Yeah.
There are really strong arguments on both sides. So let's start with the pro-AI arguments. Yeah. The people who really see AI taking a bigger role in healthcare, they highlight its efficiency.
Right.
Imagine AI handling routine stuff, like looking at scans, analyzing blood work, even giving like preliminary diagnoses.
Wow.
That would free up human doctors to really focus on what they do best. The personalized care, those complex cases.
Right.
The human connection.
So it's not about replacing doctors. It's more like redefining their role. Yeah. AI handles the number crunching, and doctors get to spend more time with patients, focusing on the human side of medicine.
Exactly. It's about collaboration, like human expertise combined with AI analysis. This kind of partnership could even help with access to healthcare, especially, in areas where there aren't enough doctors. AI-powered telemedicine. That could connect patients with specialists all over the world. Like, imagine a world where your location doesn't limit your access to quality care.
That's amazing.
Yeah.
Yeah, that sounds amazing. But I bet the pro-human side has some pretty valid counter-arguments.
Oh, yeah, absolutely. We are talking about people's health, their lives. It's not just about, like, numbers and efficiency.
Right.
The pro-human side really stresses how complex human health and disease are. All the gray areas that AI with its data and algorithms, might have trouble navigating.
Yeah.
They say human doctors, they bring something unique to the table, like years of experience, training, intuition, and they make judgments based on more than just like the raw data.
So in those tricky situations, you still need a human doctor to like weigh the risks and the benefits, think about the patient's values, and ultimately make the best call for that specific person.
Exactly. Think about a patient facing a tough decision, one where there's no easy answer. AI can maybe present all the data, the stats, the possible outcomes, but it's a human doctor who can really sit with that patient, listen to their fears and hopes and guide them through that whole process with empathy, with compassion, that human touch that ability to understand, what a diagnosis really means emotionally. That's something AI can't do.
It's like that saying, data isn't information. Information isn't knowledge. Knowledge isn't wisdom. AI might be great at processing data and spitting out information, but it's human doctors who bring the wisdom, that understanding of what it means to be human to medicine.
Yeah, that's a great way to put it. And it's not even just about individual care. The pro-human side also talks about how important the doctor-patient relationship is, that foundation of trust. For effective healthcare, patients need to trust their doctors, believe that they're being heard and understood, and that their needs are being considered. That's where that human element really, really matters.
It's about feeling seen and heard, not like you're just a bunch of data points, but like a whole person with your own unique situation and concerns. There's a level of comfort and reassurance that comes from talking to a human doctor. Someone who gets your fears, validates your concerns, and can offer encouragement alongside a treatment plan.
Exactly. And we can't forget accountability. What happens if AI makes a mistake? Who's responsible? Is it the doctor who trusted the AI's analysis, the hospital that uses the AI system, the developers who made the algorithm? These are tough questions with no easy answers, and they show how complicated it can be ethically and legally, to bring AI into healthcare.
It's like we're trying to find a balance, right? We want the amazing potential of AI to improve healthcare, but we got to be careful to make sure patient safety, privacy, and the human side of care are always top priorities.
Yeah, it's not about AI versus doctors. It's about how we can combine these two powerful forces, to create a system that's more efficient, more accurate, and in the end, more human-centered.
So what does it all mean for us, the patients, as AI becomes more common in healthcare? What should we be thinking about? What questions should we be asking?
That's a great question. It's really important for patients to understand how AI is being used in healthcare, to know the potential benefits and the limitations. Don't be afraid to ask your doctor how AI is being used in your care, what data they're using, and how it's affecting their decisions. Be an active participant in your healthcare.
Have those open conversations with your doctor. Understand how AI fits into your treatment plan and feel confident that your needs and preferences are being considered.
Exactly. As AI keeps evolving, it's crucial that we all talk about its implications, make sure that bringing it into healthcare benefits every patient.
This has been such a fascinating deep dive into AI in healthcare. It seems like we're right on the edge of a huge transformation, and healthcare is going to look very different in the next few years.
Yeah, the pace of innovation is incredible, and even though there are challenges, the potential for AI to improve healthcare is really inspiring. We're entering this new era of augmented healthcare where human expertise and AI tech work together to improve patient outcomes in people's lives all over the world.
And as we move into this future of healthcare, it's important to remember that this is a journey we're taking together.
Yeah.
Doctors, patients, researchers, technologists.
We're all in this together, and by talking openly, collaborating, and committing to ethical and responsible AI development, we can create a healthcare system that really serves humanity.
This deep dive has given me a lot to think about, and I'm sure our listeners have some questions too as AI becomes more part of our healthcare experiences. It's so important to stay informed, have those conversations, and push for a future of healthcare that puts both technological progress and human well-being first. It really does feel like we're standing on the edge of something huge, like a whole new era for healthcare where things that seemed impossible are suddenly within reach.
It is exciting. I mean, just think about it. AI could actually help us, find cures for diseases that have been around for centuries.
Yeah.
We could have personalized treatment plans based on our, individual DNA. We could even predict health problems before they happen, and actually do something about it.
It's like science fiction coming to life.
Right.
But like any really powerful technology,
Yeah.
there are going to be challenges.
Oh, of course.
We've talked about some of them, the data privacy issue, bias in algorithms, needing human oversight. What else should we be watching out for as AI becomes even more important in healthcare?
Well, one of the biggest things is making sure AI benefits everyone, not just, a small group. We got to make sure that AI healthcare is accessible, it's affordable, no matter your income, where you live, your background. We can't let AI make existing healthcare disparities even worse. We need to use it to make a fairer system.
That's so important. Technology should help everyone, not just widen the gap between people who have access and those who don't. So what can we do to make sure AI is used ethically and responsibly?
Well, it starts with conversations just like this one. We need to really talk about the potential benefits and risks of AI, and we need everyone at the table, doctors, tech people, Patient advocates, the public, we've got to set clear rules for data privacy, transparency with algorithms, and we always need humans keeping an eye on things. And of course, investment in research and education. Healthcare workers and just regular people need the knowledge to navigate this new world.
It sounds like a group effort.
Yeah.
Like everyone has to be responsible for shaping the future of healthcare, putting innovation and well-being at the center.
Absolutely. And it's not just about, avoiding risks. It's about embracing the opportunities that AI gives us. Imagine AI helping doctors make better diagnoses, personalizing treatments, even finding cures we never thought possible. Imagine AI giving people the tools to really take control of their own health, making informed decisions about their well-being.
That's a powerful vision. A future where technology and human, brilliance work together to make healthcare better, more compassionate, more available for everyone.
Yeah.
So as we stand here, ready to dive into this new world of AI and healthcare, what's the one thing people should remember? What should our listeners be thinking about?
The most important thing is the future of healthcare isn't set in stone. It's something we're creating right now through our choices, our actions, how much we get involved. Stay informed, ask those tough questions, demand transparency, and fight for a future of healthcare that aligns with your values, with what you want to see.
This deep dive has been an incredible journey, exploring this uncharted territory of AI and healthcare. There's so much promise, a lot of uncertainty too, but ultimately it could completely revolutionize how we approach health, wellness, even how we understand what it means to be human.
And as we go deeper into this uncharted territory, let's not forget, we're not just along for the ride. We are the navigators, the explorers, the ones building a future where technology serves humanity, and healthcare is a source of hope and healing for all.
It's been a fascinating look into the world of AI and healthcare. It's clear that we're on the brink of a massive shift, and the choices we make today will shape how healthcare looks for generations to come. So as we wrap up our deep dive today, let's all commit to staying informed, asking those tough questions, and advocating for a future where technology and humanity work hand in hand to create a healthier and brighter tomorrow for everyone.